A 48-year-old man from Mathare is the latest fatality of COVID-19, bringing the death toll to 51. This on a day the Ministry of Health's voluntary mass testing drive continued in the country's sprawling slum, as well as in Mukuru and Huruma. Well, even though a high turnout was recorded, the ministry warns of a disturbing trend of individuals who provide wrong contact information during the process, and once the results are out, the individuals then become unavailable. Dorcas Wangira with more.
At St. Teresa's Girls in Mathare, hundreds voluntarily show up to be tested for COVID-19. In particular, this resident brings his 2 children to be tested. For his daughter, getting the oral pharyngeal swab isn't much of a challenge. He has to hold her when the health official collecting the samples inserts the swab into one nostril straight back, rotates the swab more than once, collects the sample material, and then inserts the nasal pharyngeal swab material into a vial. She cannot hide her discomfort and irritation. It's over in a matter of minutes, but getting the results will be a matter of hours.
Hii ni damu yangu na naipenda sana. Na bado niko na familia ingine. Na tena nafurahia sana na ile familia nimebakisha huko lazima wakuje wapime.
The government's mass testing drive targets 1,000 tests a day. At this particular center, Sunday, the turnout surpassed the 300 target. Those who could not be tested were advised to return on 29th May.
Niliamua siwezi kaa tu na mimi ni mtu wa kuendesha potapota. Nikaona wanatangaza watu wakuja wapimwe. Wengine wanabishana wanasema ni ya mashetani, mara ya nini, wanasema pona wajakupea chakula na wanataka tupimwe. Sasa wakaanza kubishana, tuwezi enda kama wajakupea chakula. Mimi nikakitokesea nakasema acha niende nipimwe.
The clients will receive the results within 24 hours and they will receive through an SMS. A message. You had a contact, the only thing you come is just the screening. If you're negative, you're okay. If you are positive, you are given the treatment.
Mathare, being an informal settlement, is on the Ministry of Health's radar as a potential COVID-19 hotspot. With the population lacking decent housing, clean water and sanitation, the likelihood of widespread infection is high. 2 positive cases and 1 COVID-19 death were recorded Sunday from Mathare.
And I also want to commend those that have presented themselves, and we have seen that more and more Kenyans are now coming out on their own to present themselves for testing. The more we do this, the more we understand the level of transmission.
Providing false information at the point of collecting samples is proving counterproductive. For some who have tested positive could not be traced, the appeal from the ministry is for people to be responsible and provide accurate contact details during testing. More targeted mass testing will continue in Nairobi and Mombasa. On Monday 25th, it will be carried out in Westlands. On Tuesday 26th May in Kibra and Langata. On Wednesday 27th, Kasarani and Roysambu. On Thursday 28th May in Ruaraka and Langata. On Friday 29th May in Mathare and Westlands. And on Saturday 30th May in Kamkunji and Makadara. The schedule closes on the end of May, Sunday 31st in Kamkunji. Dorcas Wangira, Citizen TV, Nairobi.